So before we get into types of pelvic floor training in pregnancy, I actually want to just talk a little bit about what the pelvic floor is and what it does. Because pelvic floor, it's thrown around a lot out there, but a lot of people don't really know what it is or what it does. So the pelvic floor is a sling of muscles. There's tons of the muscles around the pelvis, and they all have several important functions. So one of them is continence. It also has a sexual role, so it helps with blood flow and maintaining tone during sex. It supports your pelvic organs, so it holds up your rectum, your uterus, and your bladder. And when it's not supporting it very well, it can lead to things like prolapse, which is when the organs are pushing through the pelvic floor wall. The pelvic floor also functions to stabilize and support the spine and pelvis along with your deep core. And then lastly, it has what's called a sump pump action. And a lot of people don't know this about the pelvic floor, but it has tons of blood vessels in the area, and it has a big circulatory function. So as you can see, tons of very important functions of the pelvic floor. And with pregnancy, like we said earlier, you get a lot of weakened and stretchy muscles during changes in pregnancy. And this can really impact the functions of your pelvic floor. So why are pelvic floor exercises important in pregnancy? Well, by having a good, strong, functional pelvic floor, it's going to help reduce back pain and our pelvic girdle pain. And we talked about this earlier, right? Like more than 66% of women get low back pain in pregnancy, and more than 20% of women get pelvic girdle pain. So if we can have a nice, strong, functional pelvic floor, this can help prevent or limit this. It can decrease the risk of injury during birth. It can actually lead to a shorter active labor if you have a good functioning pelvic floor, which is very nice. It can help reduce postpartum conditions such as incontinence, dyspareunia, prolapse, that kind of thing. And lastly, it can really help speed up postpartum recovery. So a lot of really good things to justify why it's important to do pelvic floor exercises. Now, this slide, I think, really drives it home, but I just wanted to show you guys this little stat here. So about 50% of women lose some of the supporting function of the pelvic floor due to childbirth, and about 20 to 60% of women have major injuries to the pelvic floor muscles following a vaginal delivery. So, pretty significant stuff here, guys. If we can do whatever we can during pregnancy to help prevent this, that's the best situation, and pelvic floor training can do this. So how do we train the pelvic floor? I think the first thing that comes to mind when anyone thinks of pelvic floor training is Kegels, right? And Kegels are super important. They help strengthen the pelvic floor. It's a contraction. And I coach my clients through how to properly do that. Now, there's actually a lot of important pieces with the Kegel. It's not as simple as it sounds. We have to work on the speed. We have to work on endurance of the Kegel. We have to work on the coordination and just general power, right? Now, in addition to Kegels, what's just as important as strengthening is pelvic floor lengthening. A lot of people don't realize this, but pelvic floor lengthening, or reverse Kegels, as what we call them, is super important. In fact, I get a lot of women that come to clinic with pelvic floor dysfunction, and they've been doing tons of Kegels, but nothing's getting better. And what I often find is that their pelvic floor is actually really tight, and they need to lengthen and learn how to relax it first before they can appropriately strengthen. The perineal massage is the last point here, and this is super important during pregnancy. It's a preventative technique I show all my clients, and basically it's to manipulate and massage the perineal area to prepare it for birth. Now, the perineum is the most commonly torn area during childbirth, so really important to try to manipulate and stretch out the tissues to reduce the chances of tearing as much as we can. And most people who do it consistently, especially in the third trimester, usually have much lower chances of tearing during birth. So another true and false, last one, I promise. This is related to pelvic floor, and I get a lot of questions about this in clinic. So I wanted to see what you guys thought. A good way to practice Kegels is to try practicing on the toilet. What do you guys think? If you don't mind, just throw it in the chat there. Let's see. True, false, true. Yeah, false, true. Yeah, a bit of a mixed bag here. The answer is actually false. And this always surprises people, because I do have some people say that, oh, someone told me to just try to stop the flow of urine on the toilet, and that's how you do a proper Kegel. But the pelvic floor and the bladder have a very important relationship, and they actually work in opposition. So when you're going pee or you're emptying your bladder, your pelvic floor actually needs to relax in order for you to fully empty and for the bladder to fully contract. So if you practice Kegels, i.e. contract the pelvic floor, tighten the pelvic floor on the toilet, it actually can mess up the signals coming from the brain to the pelvic floor to the bladder to fully empty. And over time, that can actually really disturb your ability to empty your bladder and even your bowels. So please, guys, do not practice your Kegels on the toilet. This can actually be quite harmful in the long term.